Hello, everyone. Dr. Vinod, Dr. Anil, Dr.
Hi, good afternoon to everybody.
Good afternoon, everyone. Okay,
Good afternoon.
so I think we are ready to go.
Except my obesity is, I don't know, upside down क्यों हो गया obesity?
That you can, no, we can see it clearly. That's fine.
Not
It's clear to
upside.
it's fine.
Yeah, it's
Okay.
fine. It's fine.
For me,
So, good
it's
afternoon, everyone, and Ramadan Kareem to you and your families. I am
thank
Dr. Satendra Kumar Multani, consultant endocrinologist at Prime Health and moderator for today's session. It is my absolute pleasure and honor to welcome you all to this special live session on World Obesity Day, that is 4th March, hosted by Prime Health. Today, we are diving into a crucial discussion: obesity hitting the bullseye. Obesity is the biggest pandemic of this century, affecting nearly 1 billion people worldwide, thus creating a major public health crisis warranting urgent attention and action. It is the commonest disease in United Arab Emirates, affecting nearly two-thirds of population. And every third adult or adolescent is either overweight or obese here. Obesity can lead to more than 200 complications, and some worth mentioning are type 2 diabetes, heart disease, fatty liver disease, osteoarthritis knees, obstructive sleep apnea, polycystic ovary disease, and so on. Yet, despite its widespread prevalence, obesity is often misunderstood, under-recognized, and undertreated. But there is hope. A new era in obesity treatment is revolutionizing the way we approach and manage it. Today, we are privileged to have with us five distinguished experts from diverse fields who will share their insights on the latest advancements in obesity treatment and prevention, including medications, surgery, dietary strategies, and behavioral intervention through hypnosis. Allow me to introduce our esteemed panel of speakers. Dr. Asiya Nabi, General Physician and Deputy Director, Prime Digital at Prime Health. Dr. Anil Kumar, Consultant Endocrinologist at Prime Health. Dr. Vinod Kumar Singhal, Consultant General and Bariatric Surgeon at Prime Health. Ms. Jinu Mary Prasad, Senior Clinical Dietitian at Prime Health. And we have one special guest speaker, Dr. Naheed Khan, a freelance hypnotherapist and neuroeducationalist. So please welcome them, and we request our audience to participate actively to make this session very interactive and informative. So let's get started. So meanwhile, while the audience is getting ready for questions, let me start the questions to our expert panel. So my first question is to our general practitioner, Dr. Asiya. So Dr. Asiya, from a general practitioner's perspective, what are the key misconceptions about obesity in community that need to change?
Thank you, Dr. Kumar, for that important question, and good afternoon, everyone who has joined us today.
Yeah.
One critical misconception is that obesity is not a disease. So why to treat it? Another, currently social media video recipes can solve the problem overnight. Any food hacks that can solve your obesity overnight, cinnamon powder or anything else. Another myth is that crash diets or extreme exercise alone can solve the problem. Oversimplifying belief that obesity is solely a failure of willpower. In reality, it is influenced by some major important factors like genetics. A genetic accounts for nearly 40 to 70% of individual predisposition to obesity, far more important than we generally think. Other thing is your metabolism, how your body behaves to what you eat, hormonal influences like thyroid or other things. Insulin resistance itself is individual factor which can lead to obesity. environmental factor. Availability of food is the major culprit.
Thank you, Dr. Asiya, for the wonderful answer. And the next question, further to that, is Dr. Anil. Can you tell us how does obesity develop? What is the complex interplay of different factors? That Dr. Asiya suggested some of them. So, can you just elucidate it in more detail?
So, as good afternoon, everyone. As Dr. Asya suggested, I mean, it's a very complex. Obesity itself is a complex, and first we need to recognize this as a disease, like how diabetes is a chronic disease, obesity itself is a disease. So it's a multifactorial. So it's not only from like overeating, yes, abundance of the food is one, Dr. Asya mentioned, but also it's genetics which plays a role, and majority of the time it's the combination of multifactorials which causes, I mean, childhood obesity now we are seeing more and more because of the lack of activity, and then that's going on to adulthood, and in adulthood itself it can be from the simple thyroid to polycystic ovaries or insulin resistance, and also the medication. Some people might be taking some medication for like a low mood and things like that. So it would be complex always when we see important thing for the patients or from the doctor's point of view, recognizing obesity itself is the initial. So a lot of things, so people call it as a healthy weight. So it's not healthy. It's unfortunately, this is causing a lot of unhealthy problems. So recognizing these complex issues, it can be coming from so many factors, and then approaching is important.
Yeah, so one of our active participant has suggested and summarized it also, that is stress, processed foods, increase in portion size, and snacking are some of the major issues along with underlying genetic issues. Thank you, Ms. Suchitra Chaudhary, for your insights. Thank you so much. So my next question is to our dietitian, Ms. Jinu. So Ms. Jinu, tell me, diet plays a crucial role in obesity management. What are some of the biggest mistakes people make when trying to lose weight?
Thank you, Doctor, and good afternoon, everyone. As Ms. Suchitra rightly said, participant, losing weight can be a very challenging process. Many people make mistakes that can hinder the progress or even lead to negative health outcomes. And some of the common mistakes that people do is following extreme diets like fad diets or fasting, skipping meals, eliminating the entire food groups and focusing on single nutrient, over restricting calories, drinking too many calories, not avoiding strength training, ignoring hunger and fullness cues, neglecting such hunger cues, and don't know when to stop and when not to, and not eating enough proteins. These kind of slows down the metabolism, and it leads to unsustainable weight loss. And these are some of the biggest mistakes that people do while trying to lose weight.
Thank you, Jinu. My next question is to our guest speaker, Dr. Naheed Khan. So, Dr. Naheed, the mind plays a significant role in weight management. How does psychological health impact obesity, and what mental barriers prevent weight loss?
Assalamu alaikum, everyone. And this is a great topic and a great day today to spread this message. And I acknowledge, first of all, such learned and an esteemed team here with me who is being the cause in the matter to serve the mankind and to help people in obesity. So I acknowledge each one of you here. And I acknowledge our audience who is listening to us. So, yes, thank you for asking this question. Mind is the king of all senses, because here I will give you a very different view. Of course, we want a different perspective because we really grow with new perceptions, because these new perceptions, new views make us a new you. And a new you can take new actions, and new actions will give us results. So mind plays role, as one of the audience people had just mentioned, that people are binge eating and they are not like seeing the portion size and eating at any time. So this is because the mind is not able to control our senses. Now here I will give you very easily everybody will understand why we are doing it, because we don't want to do it, but it is happening. And so many people we will come across, they will say, we don't know, we know it all, everybody knows how to stay healthy, but still this is happening. So our brain works on law of conservation of energy. So it loves to do everything where it will conserve the energy, like eating. And whenever there is some stress, which is a trigger for the body, so the body gets alarmed and wants to eat. When we feel emotionally low, energy is less, fear, self doubt, worry. These are three things which are bothering human beings the most. And Dr. Asiya, I agree with you. You said genetics is important. Yes, because we ourselves in our DNA are carrying this information. So the mind is actually controlling everything. So we need to control our mind. So we will see lately in this session how we can do it. And the common barriers, of course, which are preventing us is because we are not able to pause or slow down. These are the most easily expressed way I want to bring the common barriers. I will explain you just in 1 minute in a very simple way. Like it is, we are human beings, but we are not human beings. We are always human doing, human thinking. If this example everybody will relate. So where is the human being, the pause, the slow down? So this is the most important, like the awareness everybody can have.
Thank you, Dr. Naheed. And my next question is to Dr. Vinod. Dr. Vinod, surgery is often seen as a last resort for obesity management. In what cases do you recommend a surgical intervention and who qualifies for it?
Well, interesting question. Answer is very simple. The patients, the obese patients who have tried their hard to reduce weight with their lifestyle changes, weight reduction therapies by the dietitian, by their daily gym activities, or their own diet patterns, if they have failed and their medical risks, which are making them incapacitating them in terms of carrying out their daily activities, especially like uncontrolled diabetes or uncontrolled hypertension, uncontrolled osteoarthritis, which is making them unable to walk or do their routine daily work. Some patients who are not able to sleep in the night, or they sleep too often in the daytime because of their sleep apnea, because of the obesity, and their weight is more, especially after BMI of 35, they do qualify for the bariatric surgery. So it's definitely is a last resort when somebody has already exhausted all other non-surgical methods of weight reduction. Then only they do come to me, and then we evaluate them whether they qualify for the surgery or not.
Thank you, Dr. Vinod. Now we have one question from Dr. Priyanka Garg. And it's a very useful question, and I would like to direct this question to Dr. Anil Kumar. She asked me, she's asking us how to manage weight in hypothyroid patient. So, Dr. Anil, what's your suggestion or answer for that?
So, see, important bit in hypothyroidism itself is managing hypothyroid. That means that you take the thyroxine an appropriate dose and keep your TSH well below 3. And so, at least in that sense, the obesity is coming, which weight gain is coming from hypothyroidism is mitigated out. So that's most important. I mean, sometimes we keep it even the best value is 2.5 and low, but at least below 3 should be there, the TSH, to make sure that hypothyroid zone. Otherwise, the overall management of the weight or obesity in hypothyroid other patients are similar, except for make sure that the thyroid is well controlled.
Yeah, I would like to add something in there, Dr. Priyanka, that hypothyroid patients, they have tendency to gain weight because of their slower metabolism, and they need more physical activity to lose weight because of the metabolism, error in the metabolism. But one more thing we have to remember, that we cannot like blame hypothyroidism for the whole weight gain because it's mostly responsible for 5% of the weight gain in individual person. But we have to see the genetic background, the overall physical activity, and overall food intake of those people. So, diabetes and thyroid are two conditions which are being blamed for most of the problems by most of our fellow physicians and the general people. So we should always see that whether hypothyroidism is truly responsible for that weight gain or not, because there are many hypothyroid patients, they don't gain weight also. So, so background is very, very important to check. And the treatment is, as Dr. Anil said, that the diet control of hypothyroidism. And then the other therapies, they remain the same. Suppose somebody has to go for the oral injectable medications or surgery, then the indications, they remain the same actually for those people also. Now, there's another question from Dr. Priyanka. Is for our dietitian: how to work on digestion and absorption. So, Jinu, would you like to answer that? How to work on digestion and absorption? So, I didn't understand, Dr. Priyanka, what is the rationale of this question? Like, what are you like trying to get from dietitian? So, if you can be more specific about this, and that will be easy for our panel member to answer. If you can elaborate a little more. So I think we'll wait for her answer. Meanwhile, I'll ask the next question to Dr. Asiya. Dr. Asiya, many people struggling with obesity, they don't seek medical help until complications arise. So, what early signs should individuals should watch for, and when should they consult a doctor?
Thank you, doctor. This is very, very important. Being general practitioner, what I see generally is that people, out of 100 obese people, hardly 10 or 15 would like to talk about it, but it will not be their direct concern. It will be like an add-on concern to the routine health issues they are coming to the OPDs, like upper respiratory, like gastro or anything. So this is a casual talk, not the direct talk that, doctor, I am obese, I have weight gain issues. Is there any way to address it? This is such an alarming issue right now, and in generally in my OPD, I don't see people talking about it. And those people who want to talk about it, biggest problem is the stigma and unawareness of the risk thresholds. Coming to the risk is majorly anyone who's, in short, waist circumferences for women is more than 38 inches. For men, if it is more than 40 inches, are high risk for 2 to 3 times higher risk for cardiovascular diseases in the future. If your blood sugar fasting is more than 100 milligram per deciliter, if you have already diagnosed with hypertension or casually have done any screening where you have seen blood pressure of more than 135 or 135 by 85 millimeter mmHg of high blood pressure, you should seek opinion, that because these are directly linked to obesity in the future. Then most importantly, unintentional weight gain. I'm not doing anything, but still it is gaining weight. It may be linked to sleep disorders, like Dr. Naheed said. Adequate, you are sleeping, but you're completely sleeping for 7-8 hours, but still fatigue you feel. These are again the risk factors to evaluate. Then irregular periods, specifically linked to PCODs, are major issues to look forward to. These are risk factors which we should look forward. And nevertheless, I'm sure our speaker will talk about it. Persistent hunger, even after eating, you don't know why you're hungry, and you feel, you don't know, you can't differentiate between thirst and hunger. So you keep on eating, and stress induced eating, you keep on eating junks every 2 hourly, you don't feel like fulling. All these features, or one of them or some of them or two of them, or apparently you look not fine, single cause is a risk factor, and you should discuss it with the doctor.
Thank you, Dr. Asya. And we have a very good comment actually, and I will appreciate Ms. Suchitra Chaudhary. And she has suggested that the challenge is educating the masses on this multifactorial epidemic. You're absolutely right, and that's the first initiative from the Pine Health, and we really want to educate masses. And we have taken the first step, and in future we will be doing more of such live sessions and maybe some face-to-face sessions also. To increase the awareness, because this is really the biggest pandemic of this century. Dr. Priyanka has replied that in hypothyroidism patient, metabolism is main concern. So how to work on this? And more questions: which food help in reducing weight for hypothyroid patient? So I think me and Jinu can answer that. So Jinu, you can take it first.
I think for hypothyroid patients, it's the same like any other patient, concentrating more on a overall balanced, healthy diet and not just focusing on a single nutrient. They need to be very active physically as well, and concentrating more on a maintaining the weight by focusing on a healthy diet, which is by increasing more fiber in the diet, concentrating more on complex carbohydrates, limiting the processed foods, being and also doing physical activity, which is exercise. So that's the only way. There's no specific diet for a hypothyroid patient. It's the same, just like any other patient, but they need to make sure they follow a strict regime, and avoiding such food in their diet can help.
Yeah, so regarding metabolism, again, that can be boosted with high protein diet and regular exercise, the different types of exercise, not just focusing on one kind of exercise. We always advise to target three types of exercise. We call them as FAR. FAR is flexibility, which comes with the stretches. Then A for aerobics, which is running, jogging, cycling, swimming, and R is resistance training. When these people, they do all, not only these people, everyone should do that. When they combine all these three exercise in the right proportion, then metabolism can be boosted. So exercise plus the balanced healthy diet with rich in protein actually can accelerate the metabolism in such people. Thank you, Dr. Priyanka. It was a great question. So now my next question is to Dr. Anil. Dr. Anil, currently, what are the commonest barriers in treatment of obesity, which you see in your clinical practice? Why people are not able to get treated timely? What are the main barriers?
So, as Dr. Asya mentioned, the recognized itself is very poor. You see so many patients with arthritis go to orthopedics with weight problems. They treat the arthritis but not recognize the obesity itself. And the next important barrier from the patient itself is not recognizing they've got a problem. And another important, as Dr. previously mentioned, is patient has tried some diet and they lost weight, but they regained the weight. They think that no point in doing it ever. So that is one of the commonest thing what I see in my practice work. I've done this, no point in doing. I'm doing the physical activity, and I can gain the weight from not doing anything. So we need to sit and again, some another important patient mistake is they go for some online diet, and I can go with the Prime logo, personalized care personally, because until unless we cater to individual need, they will not be effective. So that's the most important, recognizing it and seeking help, and then seeing one of the experts, and then at least as a general physician or internal medicine or as endocrinologist, we can spend time, find out what's the problem, and then treat accordingly. Doesn't matter, I mean, somebody has taken medication, it might not work for them. So again, that's a barrier. And again, from the once if they recognize it, the cost effectiveness, I mean, the cost issue comes. Can they afford the medication? Because insurance is not covering obesity currently. That's a major issues again. So if they're able to afford for the medications, for example, the injections they can do. And other important thing is again, going by the social media, they look at the problems from the medications, or they find out the reasons why not to seek help. They will going to alternative therapy, and again taking a lot of medications which might do work in the short term. And sustainability is other major issue which I see in the my regular practice.
So insurance also is one of the major issue which we see that most of the people, because insurance themselves, they don't recognize obesity as a disease. So this is
Unfortunately.
the biggest paradox of treatment of obesity. So I hope that it will be accepted as a disease, so more and more people can be benefited. Now we have a very good question from Miss Sunita, and she has written that as per my BMI, I fall in the obese category. At what age does weight loss becomes more difficult even with a good diet? So Dr. Anil, you and me will take first you start, then we'll add
Okay.
something. If you
So that's, I mean, very important. I mean, unfortunately for obesity, there is no age now. So we are seeing obesity from even early ages, like in the primary school levels, to even elderly. That means even 75 years as well. So it can come at any time, and also there is no. I mean, maybe, I mean, yes, there are few parts of the life, like for example, you're going through the stressful periods, exams, the menopause, where they got other metabolic things happening. It may be a little difficult compared to a normal person, but I don't think there is any age barrier to say it's difficult to lose at this point of time. So we need to work on all the factors at this time.
Yeah, so we can say that, Sunita, that it becomes more difficult relatively, not absolutely, as you grow older, because the overall metabolism slows down, and you need to do more hard work, and you need to really go drastically down in your carb intake and all to lose weight. So as we grow older, we need to do more effort to lose weight, and mostly after 40s and 50s and 60s, it has become more and more difficult. But ultimately, if you seek the right guidance, and if you are determined, and if you have all the tools, then you can lose. We have people who can lose, who have lost weight in their 50s and are late 50s and early 60s, and we have people who are in their 30s and all, they don't lose. So it all depends on how motivated you are and how committed you are, and whether you are seeking the right guidance or not. So we have, one important question now. I think this is for the Dr. Anil. So, doctor, can we stop weight loss injections suddenly? If somebody is taking weight loss injections, which has become a very trend, and you will see now and there, here, you will see a lot of people are taking it. And my concern is that now the normal weight and normal individuals, they come to us in the clinic to get the injections because of so much of peer pressure
Yeah.
everywhere in the office or in the community, that I get surprised when people with the normal BMI, normal waist circumference, they come that I want to lose weight because my colleague is taking in my company. Can you prescribe to me? I said,
Yeah.
so there are specific indications. So let's do this way. Dr. Anil, would you like to first discuss what are the specific indications for those weight loss injections? And then we add question in that from Dr. Mr. Salim. Can we stop them suddenly?
Yeah, I mean, it's very important, as you rightly said. So, weight loss medications are approved, or what we use are in patients who got a BMI more than 30 and above, or if they're 27 and above, we got some metabolic issues like having a high fasting sugar or a diabetes itself, or you got a high blood pressure or high cholesterol, or issues with sleep apnea where there is a very high weight causing them increased snoring, daytime sleepiness, like a sleep apnea being diagnosed, or they got a the fatty liver or the liver issues coming from the high fat related. And if they've got any of these with BMI 27 and above, then definitely they are to be considered or suitable for injections therapy which are currently available. Or if they got BMI more than 30 without any medical problems, they are suitable for injection therapy.
So can we stop them once we start? Suddenly we
Okay.
can stop, or there is a like.
No, okay. So coming to this question specifically, so usually when we start, I mean, always we start with the smallest dose, get body used to it, and then we'll increase the dose as needed. Not every patient need to go up the doses. I mean, we increase the dose as needed to achieve the desired weight loss. So once we achieve the desired weight loss, then we see, I mean, let me clarify first itself. Obesity itself is a chronic disease. So that means obesity is like more or less a long-term problem. So by stopping medication suddenly might not solve all the problems. Yes, good number of patients have stopped the medications, and when they reach the desired weight, they should be on the good diet and very good exercise regime, which they are able to sustain. So then only we can think about either there are two ways of, I mean, I don't mind, I mean, going the dose lower first and then stopping, rather than if they, for example, if one of the medication and the highest dose they are taking, if they stop it directly, then the risk of the weight gain might be there. So let's go 1 or 2 steps down and see and maintain there with a good diet and exercise. Then we can think about. Definitely, I don't suggest to stop like suddenly.
I'll take this question also in continuation of this, Dr. Anil, that Mr. Mohammad Akib has asked that for how long can we continue the weight loss injections and what are their long-term side effects? Like for
Okay.
how long the data so
So
far? And
that's what I was as mentioning. It's a chronic disease. So we got patients, for example, current medication that are weekly ones available. We got patients using for 2.5 to 3 years, and they can be used for long. So the data currently, luckily, the medical data is saying that it can be used on long term without any issues, and so hence there is no cutoff to say you need to stop it like a for people with osteoporosis, we want to stop for 4 years, but not like for obesity. It can be continued for long term. And again, each individual is different. Some, yes, does every patient need to continue for lifelong? No. So again, this is the importance of speaking to your doctor, seeking the help rather than go by the social media and just take inappropriate doses. And people ended up in, I've seen so many people ended up in emergencies with vomiting because they've taken from the peer pressure with normal BMI with wrong doses and in emergency. So take the right advice, and then that can be you can decide with your doctor when to stop, and it can be continued for long, no problems, and it can be stopped as well.
thank you very much. And I'm happy that now audience is gearing up and we have more and more nice, very good quality questions. So this is a very good question for Dr. Asiya, specifically addressed to you from Mr. Saeed Riaz Al-Hamdani. That can you shed some light on epigenetic factors in obesity?
Thank you for asking this question. But I want my specialist also to back up my answer. Though,
We are
as
ready.
far as I know, epigenetics is how our environment alter our genes. So two major factors. One is the maternal diet, and second, at the time of pregnancy, and second is stress and toxins. So maternal diet, prenatal exposure, like when your baby is in the womb, to high fat diets reprograms fetal genes. So certain kind of genetics change that raises the offspring obesity risk by 30 to 50%. There was one study in 2023 related to that. So any pregnant woman, when they are eating high fat diets, that change the genetic structure. That is one. The second thing is chronic stress and toxins. Stress, when you are continuously thinking, your brain, as our Dr. Naheed says, stress is the biggest factor for anything to develop any kind of disease. So chronic stress itself changes the gene regulation, and also endocrine disruptors. That includes your plastics, that includes your perfumes, that includes your room sprays, a lot of things regulate fat storage, increasing abdominal obesity to 15 to 20%. Not only that, it is also linked to infertility. I hope that answers the questions.
Okay, well, I would like to add something in that to make it more useful for him. Well, epigenetics is a very intriguing science, and our epigenome controls our genome, our DNA. So, our DNA, action of our DNA is switched on and switched off as per the instruction by epigenome. And our epigenome is affected by our surrounding environment and atmosphere. What we eat, what we breathe, how much exercise we do, the two factors which affect our epigenome and which can alter the course of our health are what we eat and then how much exercise we do. And above all, our thinking also, because thinking is very much like we are what we think basically. So the two factors which you have to remember, our diet and our exercise have the maximum impact on our epigenome. So if we want, and that's why we say that diabetes and obesity are preventable in large number of people if we can modify our surrounding environment and can make it more epigenome friendly. So that's why we say that our upbringing set our body and mind to a different course of our life But it is in our hand when we become adults that we can change the course of our life in terms of our health, like we change the course as in terms of our career. We can change the course of our health by targeting epigenome and by feeding the right triggers to our epigenome to live a healthy life, and we can prevent obesity and diabetes if we start acting early in most of the cases, not in all the cases, but most of the cases. Now we have another important question, and this is, from Dr. Priyanka again. This is for Dr. Anil again. So she has asked that what are the side effects of these medications which we are using nowadays for weight loss, especially those injections for weight loss? The common
So,
side effects.
yeah. So, Priyanka, I can say initially the most common what we see in regular practice is the gastrointestinal, mainly in the form of say acidity like gastritis or little belching, and the feeling of nausea. And only less than 5% of the patient might have either a diarrhea, or some people even do have constipation. And so even before talk about side effects, I mean, the data for these medications from the other organs point of view, from the either cardiac, renal, or the kidney point of view, or from liver point of view, is really good. So hence the side effect profile, whatever we see, is minimal, and hence the usage is so high in obesity treatment.
Okay, so thank you, Dr. Anil, and thank you, Dr. Priyanka. Now, my next question is to Ms. Jinu, which is a very, very practical question. So, what are the best proven dietary strategies for sustainable weight loss?
Thank you, doctor. Sustainable weight loss is, best achieved through dietary strategies that can promote a long-term adherence, balance, and overall health. Many people don't get to sustain the weight loss that they're doing, and I always tell my patients that over a period of time they've gained weight, maybe say 5 years, 10 years, they've gained weight, and you cannot expect for a sudden weight loss, because some people just want to attend a wedding, or go for a function, and they just want to shed the weight all of a sudden in a month or two, which is not possible. And we always suggest for a sustainable weight loss, which is focusing on whole, minimally processed foods, increasing protein intake, prioritizing fiber-rich foods. Though there are a lot of diets, as I say, Google diets, which is like Mediterranean diet, intermittent diet, fasting, high protein, high fiber, low carb, high carb, different kinds of diets available. But the problem is, all these diets, in when they follow such diets immediately, yes, they show a good result, they shed weight, it's working. But the moment they stop such diets, which is all focusing on single nutrient, or time restricted, and whatever kind of diets they follow, what happens, it's not sustainable, and they regain the weight that they lost. So the basic thing is focusing on high fiber foods, increasing protein, lean protein intake, minimizing processed foods, following portion control, as I earlier said, for doing different kinds of exercise, be it strength training, cardio, incorporating healthy fats, staying hydrated, also focusing on reducing stress, and maintaining a proper sleep pattern, because that is also a big factor in this thing. So if these are some of the factors, if you are trying to follow, then definitely you can follow a sustainable diet by combining these strategies, which is physical activity, stress management, balanced diet, and adequate sleep. This is going to help.
Okay, now we have one question from Dr. Adil Chaudhary. So this is again to Dr. Anil. If someone develops mild pancreatitis on GLP-1, can we restart it after resolution, or should be avoided regardless?
So, in acute pancreatitis, is mild or severe, we'll stop it. And when to restart, it's always we need to make sure that all the enzymes are back to normal. There are no other issues, and there is pancreatitis itself is not a contraindication for use of GLP-1 if it's chronic or it's been treated in the past. So the when to restart is always it depends on each individual, but definitely I will not start for first few weeks after the acute pancreatitis. Maybe a few weeks down the line once everything is settled. So
Yeah, I would like to add here, Dr. Adil. Now, there is a slight confusion in this question whether you are saying that the slightly increased liver enzymes are possible after we start GLP-1, and up to 30% patient they may go up to nearly 2 times. So if it is induced by GLP-1, you have to monitor it. And if it is increasing to more than 2 times, patient is asymptomatic, and patient you did just for the concern that it can cause pancreatitis, you can continue the drug as long as there are no symptoms and it's not showing the rising trend. But if the pancreatitis is due to any other reason than GLP-1, then this is still it is a contraindication that if there's STR pancreatitis, should we give GLP-1 or not? So far, it is contraindicated if it is due to any other reason. Now, Dr. Adil has another question, that what is your experience of using GLP-1 in gastric bypass or gastric sleeve? As you know, that a lot of these patients may regain weight, especially after gastric sleeve and all. So, what is your experience of using this new class of agents in those patients? Regain.
yeah, I mean, it can be used, and we are using it. I got a good number of patients after bypass or even gastric sleeve taking the medications, and it's effective as well in these patients. But only thing is, you need to be a little careful about the gastrointestinal side effect profile, especially from the gastric bypass patients. And so dose titration should be closely monitored. Otherwise, they do respond well, like to these medications.
Thank you. So my next question is to Dr. Naheed. Dr. Naheed, hypnotherapy is a lesser known tool for weight management. How does it work, and how can it help individuals struggling with obesity?
Yeah, thank you so much for bringing this, because most of the people whom I've interacted, they don't know much about this, or they have some opinion about like being scared about hypnotherapy. While I'll say to whomsoever they are hearing me, and even after this session, the people who watch the recording, that there is something called as self hypnosis. So it is not only, that it is the work which is happening with the other person, but you, me, can work on our own self using this as a tool. Now, what is this tool? Before I come to this, I was hearing about the diet, and I am here to give a very different view because I'm coming from a very different stream. So, my dear friends, all of you who are hearing me, the problem mostly in the eating, if you will see very simply, if we will see this and even spread a word to people around, is there are actually very simply three kitchens. These are human kitchen, God's kitchen, Allah's kitchen, and devil's kitchen. So, human being is born actually to just be self-sufficient from the Allah's kitchen, the vegetables, fruits, dry fruits. But right now, if you see the big, the organization, the Zomato and other, here also we have all the food, the junk food which is there, which is in adults, it is not, it is for everybody. So this is also one cause which is like easily available. Also, I want to share here one data with people that America kitchens are closing because they feel cooking is like a time it takes. So all the people who are hearing me, because here mostly people are there who are working, cooking is a release, it is a healing, it is an activity. People around you can be there, and we can work on making the eating interesting because everything is on this tongue. Just for the taste, we are doing this. Now, hypnotherapy, coming to this part, how it helps is our conscious brain right now, which we are speaking, all the panel doctors who are here with great experiences, this is just having a speed and the power of 40 bits per second. Let us all understand this. And the internal machinery, the subconscious, where our habits reside. And this is having the speed and the power of 40,000 bits per second. So, can you see how urgent it is to know the power machinery inside us? We are still not tapped in. And we are also into a natural hypnosis. This is when the night we are sleeping from the right now we are in beta brainwave state. So when we transit to that dozing off and getting that sweet sleep, just about to get it, it is alpha state. This is 10x hypnosis. We and all of you will agree here that we are in the influence of our thoughts. So the last thought which we are while we are sleeping makes a huge impact on the other day. So I have given you very simple tools, and here if you feel if the time is aligned, there is a breathing which I would share with the people, because 90% of the people they don't breathe properly, and 40 days we can be without food, 4 days we can be without water, but breathing the oxygen fuel 4 minutes also is a long data which I'm sharing.
Yeah,
So
let
we
us some question answer, then we can take that. I would like to summarize that in a simpler terms, actually, the hypnotherapy, the self hypnosis, is regulating, controlling, and directing your thoughts in such a way that you get the desired outcome in whatever purpose you are working on, whether it work on your health also. So just you have to regulate your thought, control your thoughts, and direct them to a right place to achieve the desired outcome, and everyone can learn and practice it. Now we have very important question which I'll direct to Dr. Asiya, because this type of patient can come to Dr. Asiya. Yeah, she's Neelam Javed, and she's saying that, hi, doctor, my BMI is 26, trying to lose weight for last 6 to 8 months, doing regular exercise with diet, all labs normal. Am I right candidate for weight loss injections? Before I direct this question to Dr. Asiya, we need to see whether at this BMI, whether she has central obesity, or maybe she has a good muscular physique or very strong physique, and this BMI may be fine. So before you answer this question, I'll tell Dr. Asiya and Dr. Anil to tell us that, is BMI a right tool to define overweight or obesity in each and every individual, or there are certain limitations for that?
Thank you, doctor, and thank you, Neelam, for asking this question. So, as a general practitioner, whenever a person comes in my clinic, the first thing I will look forward, what do you want to achieve? You want to achieve 23 BMI. Is that right for your health? Because 26 is just probably 3 kgs more than the expected. If you are from Asian country, then 24 BMI is also normal. So my first question to anyone who wants to take any an opportunity for weight loss is, why do you want to do it? And what you have done, and what is your main objective to reach to that. After analyzing all questions, I guide them appropriately. 26 BMI is a blessing in today's world, so I don't personally will not recommend injections at this point of time. The correct diet and lifestyle will play a great role. Now, in my practice, what I have also observed is insulin resistance is something which is still not much talked about. We need to know why we are resisting to weight. We need to know what foods we can change. We need to understand maybe there's some inflammation, and food is the biggest therapy to reverse those things. And after evaluating everything, I can suggest you better. Over to my specialist, Dr. Anil.
So yeah, I mean, completely agree with you, Dr. Asya and Satendra. I mean, BMI is Satendra was in the question, because sometimes become a person who is going to gym with regular workout exercise, and their BMI can be high because of their muscle itself. So hence, these type of patients we also look into waist circumference, as we were previously mentioning as well. So yes, waist circumference high, BMI high, then we know that yes, definitely it's a the obesity related. And if it's only the normal waist circumference on slightly in the higher end, BMI will not worry. BMI 26, as previously mentioned in earlier in my talk, the currently for approval for medication is BMI 27 and above. So hence, direct answer for this question is she's not. If all the labs are normal, she's not appropriate candidate for the weight loss injection.
Yes, I would like to pass two suggestions to Ms. Neelam, and thank you for asking this question, because we see a lot of such type of people in our clinic who are, because of the peer pressure coming for the injection treatment. Ms. Neelam, your BMI 26, if you are feeling fit and fine and you are able to do everything properly, don't have any metabolic problems or no physical limitations, please live happily with this. And the second thing I would advise you to do the body composition analysis, and you see that the composition of the fat and muscle in your body, and if there's like the fat composition, suppose the fat contains slightly more, then go for the more structured training about the exercise, and target those areas where you feel that the fat has to be reduced and it has to be redistributed. That will be more precise approach for you. So now we have another question from Miss John Shiny. This is to Dr. Anil. Dr. Anil, are children with high BMI allowed to take weight loss injections? Like, what is the cutoff for the age to prescribe, and which is the safest for children? Which injection?
Okay. So currently there are two molecules which are widely used for weight loss. One is semaglutide and other is tirzepatide. And for the children, that is only 12 years and above, the semaglutide is approved, and tirzepatide, which is Mounjaro, is approved only 18 and above. So again, I'm not sure what the age here. Children, that means only 12 and above, the medications for weight loss are allowed to use. That's only semaglutide is allowed.
Thank you.
Or
Thank you.
approved.
Now, I would like to ask Dr. Vinod a very important question. Dr. Vinod, what are the most common types of weight loss surgeries, and how do you decide for them in different patients when they are coming to you? How do you guide them that you should go for this surgery or that surgery?
Well, practically speaking, all weight loss surgeries can be divided into two kind of procedures. One in which we reduce the size of the stomach so that the amount of the food or the calorie intake is reduced. Other variety is in which we bypass the food which is being taken, so the digestion doesn't take place. So both the type of the procedure, they have their own indications and contraindications. Some are a bit easier in terms of technicality and some are more difficult. All the procedures will have their own complications as well. So there is no procedure which is absolutely safe. But if a patient who has is a super obese with a BMI of more than 40 or reaching up to 50, then we try to divide the procedure into two stages. In one stage, we do something which is easier for the patient and the complications are less. We reduce the weight, and then once the weight is reduced by 20 to 25 kg and patient is more receptible to get the definitive surgery done, then the second procedure, which is more complicated, can be carried out in a much safer way. Otherwise, a patient who is coming with a BMI of around 40 with some risk factors can be easily tackled with a safer procedure, which is restrictive sleeve gastrectomy. Had been very common, and most of the procedures worldwide had been done in this method only. So depending upon the patient disease profile, the obesity category, and the challenge which patient can accept after the surgery in terms of the diet pattern which they are following, their vegetarian, non-vegetarian, how much support they have at home in terms of their personalized care and the psychological support at home, we do tailor the procedure accordingly. So there are different indications for different procedures. No one procedure is safe for all. No one procedure can be advocated for all the patients. Hello?
Satendra, you're
Dr.
muted.
Oh, yeah, sorry. Ms. Joanna Mary has asked the question further to your answer to the previous question, that what are the common risks and benefits of bariatric surgery? which you should like explain to
Well,
patients.
yeah. So risk, basically risk are categorized in two ways. One is during surgery or intraoperative risk, Miss Joanna, which depend upon different kind of procedures. So it is a restrictive or it is a bypass procedure. So they have different risk intraoperative. Um, Post-operatively, it's a basically malnutrition. Once the patient is discharged, the patient start losing weight, then the malnutrition part comes because they are not able to eat the way they should eat, especially the vegetarian diet, and that has to be taken care of very, very meticulously by the dietitian, by the endocrinologist, and of course the psychotherapist after the surgery. In terms of intraoperative, the more common are two things. One is the leak from the procedure itself, the kind of anastomosis, the procedure which is done, and the bleeding. Once these two things are safely tackled during surgery, the thing which remains is the post-operative risk. Benefit, of course, patient start losing weight in terms of 10 kg, around 10 kg per month, and which goes up to 20 to 25% in 1 year, which is a safe goal after surgery.
Yeah, so thank you, Dr. Vinod. And we have a very good comment from Mr. Saeed Riaz who asked about epigenetics. So he's saying that our main focus should be on preventive education about non-communicable diseases, and his thinking is aligned with our purpose. Now he's asking when should we consider referring an obese patients to psychiatrists. Here I would like to correct, it should be psychologists to induce behavioral change in patients with resistant obesity. So, Dr. Naheed, would you like to answer this? When should we refer the obese patient to a psychologist? Or there's one more question similar to that: that how, like, when should we refer these people to hypnotherapist so that they can check it? Where is the problem, and how can we help them?
Yeah, this is really, thank you so much for asking this question. This is when a patient is in compulsive behavior, like even after like knowing things and even after lot of suggestions, when there is a compulsion seen, obsessive compulsive behavior seen in the person, this is a time to not to delay and to immediately refer to a psychologist, or even a hypnotherapist can help in this case. And awareness, as you said, is very minimal because data shows 87% of the people they are dealing stress, anxiety, and depression, because mostly we are on gadgets now, so there is less human interaction. So all these factors also need to be really, awareness has to be done. And thank you for spreading this awareness today.
Thank you, thank you. And I think Ms. Zara Qureshi has asked that how hypnosis can help in sleep and stress for these people who are obese. Maybe they have a lot of stress and their sleep is also disturbed because of the. So how can hypnosis help them?
Yeah, so quickly I would, because we have time constraint today. So
Correct.
we are generally meant to be to understand very easily, to follow the sun. Sun in a way like this, getting up with the sun, and our peak the hours of eating are 10 a.m. to 2 p.m. See if the sun is at peak during this time. And after the sunset, it is always advised by so many cultures like not to eat. So mostly the sleep get disturbed because at night there is so much unnecessary or emotional eating happening. We are doing some work or we are talking to someone and the eating is happening. So stress, sleep, all this is linked. And when we give direct suggestion, command to the internal machinery, which is the subconscious, which is through affirmations, meditations, many chantings, and so visualizations, you get better sleep. And we also take use of music here, because brain is more than 70% water. Most of our organs are water. Mostly they have, the influence of music is there, vibration is there. So we use all these techniques and we are already doing it unknowingly also. So thank you, I hope I've not taken much time.
Thank you, Dr. Naheed. So the last and very practical question from the audience is from Dr. Iram, and this is for Dr. Anil again. Is there any role of GLP-1 receptor agonist in long-term weight management in PCOS patients?
Excellent question, Dr. Ram, because for PCOS patient, I've spent a good number of years in PCOS research unit in UK. The weight loss is very, very effective treatment for PCOS management. So hence GLP-1, the way the act itself causing the weight loss is really beneficial for a PCO patients. You can look at the social media as well. You can see a lot of so-called Ozempic babies or other. So we have seen the PCOS patients have benefited from weight loss. Yes, is there a role for long term? It all depends on what part of the patient's profile is. For example, if they're planning for pregnancy, at least we need to stop few months before they plan for pregnancy. But if they've completed the family, if they've got a PCOS issues, weight issues, then it can be continued for long term.
Thank you, Dr. Anil. And yeah, this is one of the indication, like any other indication, to help them. And really, weight loss is very crucial. And we have seen a lot of patients becoming very fertile after losing weight with this injection, and they are getting pregnant also. Now, this is the last question from me to two of our speakers together, Dr. Anil and Dr. Jinu. As you know that the weight loss injections are very, very commonly prescribed nowadays. So what is your advice about that they should be taken under supervision? This is number one. Number two, because with this weight loss injection, when people lose weight, nearly one third of the weight is lost from the muscles. So, what dietary advices and what physical activity advices we should pass on to those people who are taking these injections to preserve their muscle mass so they don't lose their strength while losing weight? So, kindly address one by one.
So yes, I mean obviously before starting any of these injections, GLP-1 or GAP, GLP-1, you need proper assessment. And in that sense, yes, to summarize as well as to look for cause. Is there any treatable cause, like as we previously discussed, like thyroid, or is it any the insulin resistance, or is it a PCOS, which we can address. The second important bit is to say yes, is the BMI is high enough for the treatment, and yes, if that's BMI more than 30 or 27 with any of these medical issues, that's suitable. Then look for is there any contraindications, or is any patients who can't take it. I mean, again, we look into patients who got a long-standing obesity, if they develop the nerve damage, that's called autonomic gastropathy, where they're already vomiting, and then they are not might be suitable. Or if they got previously mentioned about the pancreatitis, if they got a recent pancreatitis, again they are not suitable. And I'm not worried about the medullary thyroid cancer, because we see the cells as very rare. So yes, we can't definitely, only contraindication for these injections if they got the family history of medullary thyroid cancer, or if they are already existing. But as an endocrinologist, the number of medullary thyroid cancer seen is I can count in my own 20 years of experience. So hence, but yes, definitely we need to ask the question, explore it, but it's very rare. And coming to the second part of the question, again, we need to be assessed. We need to educate them, because we need to start at the right dose and then escalate the dose accordingly, rather than take the random doses what people are done in looking at the social media. And then
Yeah,
I'll
regarding
turn to
yeah,
Jinu for answering the importance of exercise and diet.
yeah. Dr. Jinu, regarding diet, what do you advise to such people?
In order to preserve the muscle mass, people should focus on making their plate balanced, focusing on protein for sure. All their meals, the major meals, which is the breakfast, lunch, dinner, has to have ample amount of proteins. If we calculate individually as per the requirement, as per the ideal body weight, the basic guideline which we can say is 0.8 gram per kg of ideal body weight. But vegetarian or non-vegetarian, there should be sources of protein in the meals which many people ignore. That can be a, it can preserve the muscle mass. And another part is the physical activity, which is not just cardio or walking. You need to focus on more of isotonic and isometric exercises, which is also the walking and jogging and cycling, as well as stretching and yoga and floor exercises or strength training, which can, this in combination can help to preserve the muscle mass. But protein plays a very important role, and it gives you the fullness, the satiety, and it slows digestion, and it helps in many different ways. So protein has to be given focus on all the meals,
So
not just
high.
protein, but not extremely high protein, focusing on lean protein basically, and in combination with high fiber foods, which you receive from the vegetables or the fruits, and the pulses and legumes, and the high complex carbs.
Dr. Asiya, you want to say something before we wrap up?
Yeah, I just want to say thank you for this session. I mean, adding general practitioners to this session, we act as a first line defense. To all my, fellow colleagues, practitioners, I want you to increase your trust with the patient, reduce their stigma on obesity, reassure them, do proper counseling. It will just take additional few minutes, but you can change the whole mindset and do proper referrals at that particular tough time. Depending on the health conditions, do timely referrals. That is most important. Do follow-ups when your patient has gone to the specialist. Ask and follow up whether what is happening with the patient specifically for relapse prevention, weight loss, weight gain relapse prevention, and advocate for policies such as reduced processed food in the to reduce to make our environment better. That's what I wanted to say, Dr. Kumar. Thank you.
Thank you very much, Dr. Asiya, and it was indeed a great pleasure to host all of you today. And a heartfelt thank you to all our incredible speakers for their invaluable insights and expertise. We also extend our sincere gratitude to our wonderful audience for your engagement and active participation. It was really, I enjoyed taking questions, and all the questions were really, really great. And some of the people have passed many comments, and good comments. They were like, their comments were aligned with our purpose. Last but not the least, I extend my sincere appreciation and heartfelt gratitude to Prime Health for organizing this community awareness session on obesity. At Prime, we follow a three-dimensional approach, which is prevention, treatment, and cure, as part of our core philosophy, which is personalized care personally. So, I would like to conclude this session with three important key takeaways. Number one is most of the cases of obesity can be prevented and managed effectively. Number two, please seek help early if you are overweight or obese to prevent serious complications in future. And third is to adopt a healthy lifestyle for you and your family at the earliest to prevent and manage obesity. And I would like to say goodbye to all of you before we get reconnected with some other sessions with one powerful thought, which can change the trajectory of your life and your health. That is to keep your health on the top and by making it the first priority. Thank you very much and see you soon.
Thank you. Thank you, everybody.
Thank
Thank
you
you.
all.
Thank you.
Thank you.
Good day
Thank
and
you,
goodbye.
everyone. Thank you.
Thank you. Thank you, everyone.